our calculation shows that the pandemic peaked in Sweden the first part of April sometime. And then we had a slow decline of cases until we really hit very low levels from June and onwards. And during the summer, we had very low levels of spread in Sweden, probably one of the lowest in Europe. And during that time, the Swedish healthcare system continued to function very well. 70-80% of the patients in ICUs were COVID-19 patients for a while. On the other hand, there was always free beds in ICUs. Never less than 20% of the beds were free at any given time. We had a big problem with our nursing homes for a while, and that produced very high mortality, and that's the background to that we still have high levels of mortality. But since, I would say, middle of June, and even earlier and so, that was fairly quickly rectified, and cases in nursing homes fell dramatically. And our mortality rates have been on very low levels all through the summer, and is still on very low levels. So is this a success or not? I think we all need to be humbled when it comes to this pandemic, who has come back with such a vengeance in many European countries. So we should not feel safe. And we do see increasing numbers in Sweden too. Not dramatically so, and cases in hospitals and ICUs are still on very low levels. Our mortality rates are still on low levels, but it's definitely a concern. And we are instituting more recommendations on a regional level right now, and we are following the situation very closely to try to break this trend as quickly as possible. Now, what happened is that we sort of asked people to minimize their social contacts. And people did that to a very high degree. We can measure it in some ways. We have asked people to what extent they have actually diminished their social contacts and follow our advice. And continuously 80 to 90% of the population says, yes, we have really changed our lifestyle a lot. And there's even been surveys in other European countries, and Sweden comes out as one of the countries where the population say they changed most. Which I think is a sign that this advice we gave really sort of in practice gave a virtual lockdown. We can also see that on travel. I mean, domestic flights in Sweden stopped basically. They have started a bit again. Trains went down to, I think, about 30 or 40% of normal capacity. We can look at mobile phone traffic and see that people traveled or moved around 20% less than they normally do, which is a higher change than in our neighboring countries. And we still travel less compared to normal travel patterns than in any other country around us. So I think, yes, we had a virtual lockdown. We managed to achieve it mainly by getting the population to change their habits voluntarily, but also by having some strict measures in some aspects, like for restaurants, for example, we know that restaurants are places where there can be a lot of spread if you don't control them well. And so we gave a lot of regulations to restaurants. The local authorities are continuously inspecting restaurants to see that they follow those rules. When we now look into our contact tracing data, we can see that people very seldom are infected in restaurants. So that worked out. We also, as you said, cut down on big events. Another place where we know internationally it's quite often that you get big spread. And that has also been followed because legally we can only restrict certain events, quite few events, but in practice this level of 50 were instituted on all events voluntarily. So in practice, I would say that we had just as much of a lockdown as many other countries, but doing it with slightly different tools than many other countries did. But I think what we have learned, not only from this time, but also from Ebola in West Africa and a number of other incidents, that you need to be able to have a dialogue with your population. You need to get your population to understand that we have a common goal in this, and get them to understand what really is important not just telling people to put on masks or doing this or that, but really communicate that the main issue now is to try to meet as few people as possible close by, and then giving them the opportunity to sort of choose how they need to do it to be able to achieve that. I know this is difficult because it also builds on that there is a kind of trust between the agencies and the population, and that's something you don't change from one day to the next. That comes from a long time of sort of being together. And I mean, I think that's the lucky thing that we have in Sweden, that trust has been built up over years. And it's very stable. We usually quote our childhood vaccination program, a completely voluntary program, and we reach 98% of all children. 98% of all parents voluntarily go to their well baby clinic and get their children vaccinated. No coercion, no money exchanged. There is nothing happens if you don't go there. But people go there because they trust them and they trust the nurses there, and everybody sort of trusts that we all want what's best for their children. First of all, we are in a different situation, and in the spring we had a huge increase of cases with the importation from all over the world, and then we sort of needed to adjust our advice, our measures to that level of cases. Now, after the summer, we have a much lower level of cases. We have a healthcare with much more resources to be spared for more preventive work, and that's why we went for measures that we could not really do before because there was not just enough resources to do it. And one of them is to tell people in the same household to stay home if somebody in the household has tested positive, because that would make a bit more of a difference, and that would also make our contact tracing more effective now when we have resources to do contact tracing. So and we hope by that to sort of break the transmission a little bit more than with other measures in place. And we also need to understand that the driving part of this pandemic is not the elderly or the young people, it's the working age people. That's where the real drive of the pandemic is. So letting the elderly people have a little bit more of a social context, leading a little bit more of a normal life, which would improve their mental health immensely, is the way we consider it a fairly low risk with huge benefits. No, especially with the nursing homes, they've been through a huge transition, I would say. They were not very well prepared for this kind of onslaught that the pandemic was this spring. And many of them, far from all, but many of them had a lot of spread in the facilities. And of course, the people living there are the people that are most likely to die from this disease because they're both old and many of them have other chronic diseases. There was a huge effort being made, a lot of people being trained, a lot of equipment being put in place, procedures updated, testing being done in those places. And now the procedures are in place, and we have actually seen very, very little transmission in those places during the last 2 or 3 months. And that's another reason why we do believe that opening up the society a bit for the elderly people would not really carry any risk. And yes, now you can go and visit your elderly relatives in those places, but you do have to follow the rules and regulations of the place. You need to be healthy, of course. You need to have a good hand hygiene. You will meet in special rooms, keeping distance. So there's a number of things in place to safeguard that we don't introduce the disease into these places again. I think that the face mask issue is not completely easy. Face masks in healthcare, in social care and so on, of course, has a long tradition. Everybody knows how to do it. They are very, very important, both to keep staff healthy, but also to avoid the spread from staff to the patients. So that's, of course, used in Sweden all over the place, no question about that. Face mask out in society is a different kind of thing. There's a long tradition about that in Asia. But in Sweden and Europe, it's never been like that. When you look at the evidence behind using face masks in society, they are not that great. Very few studies have been done. I saw one from CDC lately that showed that this face mask might not make that much of a difference. The other studies and also modeling and so on, showing that yes, they might make a big difference, but we don't really know. It's definitely our feeling or our belief that keeping distance is much more important. And fortunately, we are in a place in Sweden where we can keep distance. We are not a very crowded country. Most of our cities, with a slight exception of Stockholm, are not very crowded. We are also a rich country, which means that we don't have to fill our buses to 120%. So we can keep distance. And as long as that works, our strategy is not to use face masks. If that doesn't work anymore, of course, we'll look at face masks and maybe use them for a short period in some places. You also have to realize that the experiences in Europe are not that great. I mean, many of the countries are now looking at huge increase of cases, have had legal obligations to wear face masks for quite some time, and which does not say it could have been even worse without a face mask. Of course, we don't know that, but it's also quite clear that face mask is not going to be the silver bullet. It's not going to make that huge difference. And then I think it's a bit dangerous to believe that you can change so much by using face mask. But of course, there are places and times when they might make a difference, and then we will of course use them. So far, we've been able to cope quite well without them, and then I think it works better in Sweden without. I get mails from many Swedes coming back from other countries and saying, "Oh, happy they are back to be back and being without the face masks." It's face mask is problematic, I would say. I'm worked in infectious diseases for a long time. It's something you use, but it's not something that you would like to use if you didn't have to.
Help us understand the role that immunity does play in this. And, could we possibly be seeing lower numbers in Stockholm today because there is greater immunity? I know you were optimistic in the spring that the large numbers in Stockholm might have led to immunity in that population. Help us understand the debate around immunity.
I mean, immunity is important, of course. I mean, we know that from infectious disease epidemiology that the immunity of a population will very much affect the way that the disease is spread. We know that from the yearly flu. The normal yearly flu, where many people have immunity around it, really slows down the spread and diminishes the spread quite a lot. I mean, a normal flu season might result in some 4 or 5% of the population getting ill or something. When we have a flu that we are not immune to, we reach level 40, 50% maybe. So of course, immunity does have a role with any kind of infectious disease almost. There's a few exceptions, but not many. The immunity of COVID-19, how that works, we don't really know very well yet. But we do know that people do get immune because 6 months or more into the pandemic, we see very, very few cases of people who have been infected twice. So logic tells us, yes, people do get immune, and in some way, immunity will slow down the spread of the disease. At what levels that will happen and how it will happen, we are still learning, I think. Part of the problem is that the immunity in the population is not homogeneous. It differs enormously between different groups in the population. We know that certain parts of Stockholm, the immunity might be up to 25-30%. In other parts of Stockholm, it's only maybe 5%. And that, of course, means that there are still parts of Stockholm that are very likely to have quite a lot of spread, while other parts of Stockholm, maybe the immunity will break the spread, at least to a certain extent. So immunity is important. But of course, I mean, what's implied in saying that Sweden goes for herd immunity is that we're sort of sacrificing people to reach that. And that is something I would like to deny very much. Once again, we have never even thought about sacrificing anybody around this. We are really trying to get the spread of the disease to be as slow as possible, using means that are not hurting the population more than it's helping them.